Hello everyone, in this video we are going to talk about instruments that are used in ophthalmology department, and these are all the surgical instruments which are commonly being used in ophthalmology department. So it will be based on the syllabus that we follow in Kathmandu University, and it is also applicable for Tribhuvan University, so all the medical undergraduates, and it might also help for the people who are watching our videos from foreign, especially India and Pakistan. It will help you as well. So let us begin with different ophthalmological instrument. So we'll begin with universal eye speculum. This instrument that you can see here. It is universal eye speculum. As you can see, it is made of a metallic stainless steel or any material it is made of, and it has an angle and it has two ends, two limbs, and these two limbs are placed on the nasal side of the eye, whereas the angle is hold from the temporal side, and it is called universal wire speculum because it can be used in both the eyes. So universal metallic eye speculum, it is a very light instrument which exerts very minimal pressure, and that will result into various advantages, that it will not cause any pressure necrosis and will not lead to damage to eye very often. So it is used for both the eyes, hence it is called as universal. It has two limbs, or the limbs are placed on the nasal part of the eyelids. The types of wire speculum that it is one of the type of wire speculum, and it is called as universal wire speculum. What are the uses of it? So this speculum is used to keep the eyelids apart, and as we are keeping the eyelid apart, now we are able to expose the eyeball very nicely, and now we are able to examine the eyeball. Now we are able to take out the foreign particles which are present in the eye, especially at the cornea or even in the conjunctiva. So what are the uses of this instrument? So it is used for examination of eye in patient with blepharospasm, as in such patient it is very difficult to open the eyes. So this instrument is used to examine the eye in patient with blepharospasm. The next thing is that it is used for removal of conjunctiva and the corneal foreign body. So as we are exposing the eye very nicely, so it will help us to remove the foreign body from conjunctiva as well as cornea without damaging it further. So third thing is that as we are opening the eye very nicely, so we can perform extraocular surgery. So this instrument is also useful for exposing the eye during extraocular surgery like squint surgery and pterygium surgery. It is also used for intraocular surgery like glaucoma surgery and keratoplasty operations. And beside that, it is also used for destructive procedure in the eye like enucleation procedure, evisceration procedure. What is enucleation procedure? It is the removal of entire eyeball leaving behind the eyelid as well as the muscle of the eye. This is called as enucleation. Whereas evisceration operation is it is also a destructive procedure where the intraocular content are being removed, but we are preserving the remaining sclera cell. Roughly 3 mm thickness of the sclera is being preserved. Right? And the extraocular muscle and eyelid are also being preserved, which are attached to the sclera. And this instrument is also used while we are cauterizing the cornea also. So this is a wire speculum. So these are different uses of it. So what are the advantages of this wire speculum? The advantage is that since it is very light instrument, it does not cause any pressure necrosis. It does not cause any corneal ulcer or abrasion. It increases the field of vision during surgery, and there is no any orbital trauma using this instrument. So this is universal metallic wire speculum. As you can see that it is a very light metallic instrument, so it has various advantages because of that. So it doesn't cause pressure necrosis, and it usually do not cause any injury to the eye like causing corneal abrasion and such like that. So it has a temporal margin and a nasal margin. So it is usually held from the temporal side, and the eyelids are kept in the above and the lower nasal side. And it should be kept in mind that you should not keep both the eyelids simultaneously. Either you keep first, upper eyelid first followed by the lower eyelid. So it is used like this. So this handle, this is kept from the temporal side, and first of all you should keep at the upper eyelid margin, then you should pinch it, and you should keep in the lower eyelid margin, and you should gradually take it apart so that we can expose the eyeball nicely. So the next instrument that we are going to talk is about forceps. So we'll talk about different forceps and we'll learn how do we differentiate them. So the first one that we are going to talk is the artery forceps. So artery forceps is in the form of a scissor. It is also called as hemostatic forceps because it is used to obtain hemostasis during surgeries. So there are different sizes of this artery forceps which are available. The sizes are large size, small, medium size as well as the small size. And the small size artery forceps are also called as mosquito forceps. So it is a blunt tip stout forceps which has a scissor like configuration, and it has a serration present at the tip and has a locking mechanism. So as you can see, the tip is blunt And if we zoom onto it, we can see multiple serrations which are present on the tip. We can also see an interlocking mechanism which is present at the base, and it can be used to block the artery so that the bleeding is stopped. So different level of locking mechanism are present in this forceps. So what are the uses of this artery forceps? It is used to catch the bleeding vessels during operation of the lid and lacrimal sac. So during ocular operation, when we are doing that, whenever there is a bleeding from a vessel, we'll clamp the vessel using this artery forceps or hemostatic forceps so that the bleeding is stopped. It can be used to hold gauze pieces while packing the socket using during your destructive operation like evisceration and enucleation operation. It is used to hold the skin and muscle stay sutures. So it can be used as an alternative as well. So this is our artery forceps. Artery forceps, also called as hemostatic forceps. As you can see that it is a blunt tip stout forceps, and it has a scissor like configuration, and it has a serration which is present at the tip. You can see in this diagram multiple serrations are present at the tip, and different sizes of this forceps are available, and the smallest one being the mosquito forceps. It is used to catch the bleeding vessels, and so that we can clamp the bleeding vessels, and it is used to achieve hemostasis. You can see that there are multiple level of interlocking mechanism. So on unlocking that, so it is present like this, and it is also used to hold the gauze pieces while packing the socket. That we are going to talk about is corneoscleral forceps. It is also known as colibri forceps. Basically, when we are talking about corneoscleral forceps, there are two types, but the most important that we must know is colibri forceps. So it is a forceps, as we can see from the configuration, but it has a very fine teeth at the tip. As we can see, this is the tip of this colibri forceps, and we can see it has a very fine tip, and we can see the tip is bent like this. You can see this, the bending which is present at the tip, and via this you can identify this colibri forceps. It's also called as corneoscleral forceps, and the use of it is that it is used to hold the cornea or scleral edge of the incision. So whenever we are doing any incision in the eyeball, especially at the level of cornea or at the level of the sclera, so the edge of the incision either of cornea or sclera is being held by this forceps, and it is, why are we holding it? So that we can suture it during surgeries like cataract surgery, glaucoma surgery, keratoplasty operation. So colibri forceps is a forceps having very fine teeth at the tip. We can identify it by the bend which is present at the tip. Uses is that it is used to hold the cornea and scleral edge of incision for suturing during cataract surgery, glaucoma surgery, and keratoplasty operation. The next forceps that we are going to talk is Kellman-Macpherson forceps. Kellman-Macpherson forceps, it is a very fine forceps, and it has a bent limb. As we can see in this diagram, it's a very fine forceps, and we can see the limb has been bent at an angle of obtuse angle. So this is a Kellman-Macpherson forceps. It is very fine forceps. So it is used in intraocular surgeries that are very fine surgeries. Like it is used to hold the superior haptic of intraocular lens during its placement. So as we know, a lens has an optic as well as a haptic, and there is a proceeding superior haptic and there is a receding inferior haptic. So it is used to hold the superior haptic of the lens. It is used to hold at this point so that we can place this intraocular lens at the capsular bag. So this is one of the use of Kellman-Macpherson forceps. So it is used to hold the superior haptic of intraocular lens during its placement. It is also used to tear off the anterior capsule of the lens during extracapsular cataract extraction. So during cataract surgery, we usually perform extracapsular cataract extraction surgery, and in this surgery what we do is that there is a lens, and as we can see from this both dimension, there is an anterior capsule of the lens as well as the posterior capsule of the lens, and this side is being shown here, and we usually tear off the anterior capsule of the lens so that we can see the content and we can extract the content of the lens, and we can keep the capsular bag in situ inside the lens. So the cutting of the capsule of the lens is done by Kellman-Macpherson forceps. Alternative use of Kellman-Macpherson forceps is also that it can be used for suture tying as well. So this is about Kellman-Macpherson forceps. I hope you are able to identify this forceps from the diagram. The next forceps is your suture tying forceps. It is used for tying the sutures during during extraocular surgery. So you should be able to differentiate this forceps from Kellman-Macpherson forceps and the colibri forceps. As you can see, this colibri forceps are also known as corneoscleral forceps. You can see a bent tip at the margin, and in Kellman-Macpherson forceps, it's a very fine forceps having an angulation at the tip, and the suture tying forceps, you can see it is there is no angulation. It just has a straight pointed end. The next forceps that we are going to talk about is epilation forceps. By the name we can understand the use, right? So it is used to epilate the cilia, and during the procedure where the cilia is being damaged or it is being misdirected, so it is used in such procedures. So how do we identify this epilation forceps? So it's a small forceps and it is a stout forceps, and we can see the blunt, the tip of the forceps is very blunt, right? So epilation forceps is a small and stout forceps which is having blunt end and flat ends. So we can see the tip is blunt and the edges are flat. It is used to epilate the cilia. Epilate means it is used to pluck out the cilia during surgeries like trichiasis surgery and in sty surgery, because during this pathological in the eye, during this pathology in the eye, either the eyelids or the lashes of the eyelid are being misdirected, and because of that it is irritating the cornea, and by epilating the eyelashes we can relieve the irritation. So it is used in this surgery. So epilation forceps is used to epilate the cilia during trichiasis and sty surgery, and it is also used to remove the cilia after electrolysis and cryolysis. So in electrolysis procedure, what we do is that we use certain electrical current, roughly 10 milliampere, 2 to 10 milliampere current is being used, and it is given at the margin of the eyelid, and it will loosen out the hair follicle so that the cilia can be easily plucked out, and it is being plucked out by the epilation forceps. And during cryolysis, what we do is we basically create a very cold medium, especially a freezing temperature at that eyelid margin, so that it can be easily plucked out. But there is one disadvantage of cryolysis, that it can result into hypopigmentation of the eyelid. So the next use of epilation forceps is that it is used to remove the cilia which is lodged into the punctum, so that the punctal blockade can be relieved. So this is about epilation forceps. So basically we have talked regarding 4 important forceps. The one of them was corneoscleral forceps. We also talk about Kellman-McPherson forceps, suture tying forceps, and epilation forceps. We also talked regarding artery forceps or hemostatic forceps, but we can differentiate them based on their configuration and based on their the appearance. Now we will be talking about hook. We have talked regarding 4 important forceps. The one of them was corneoscleral forceps. We also talk about Kellman-McPherson forceps, suture tying forceps, and epilation forceps. We also talked regarding artery forceps or hemostatic forceps, but we can differentiate them based on their configuration and based on their the appearance. Now, so these are our different type of forceps that were used in ophthalmology department. So we can see these are 3 different types of forceps, and one of them is, as you can see in this diagram, this is our Kellman-McPherson forceps. So how do we identify this forceps? Is by this, we can see that the tip is ending as an obtuse margin. So this is how we differentiate Kellman-McPherson forceps, and it is used for it is used to locate the lens by using the anterior haptic, right? And it is also used for anterior capsular axis. So the next scissor that we are going to see is, this is our suture tying forceps. You can see the tip is very pointed and it is straight, and it is used for tying the sutures. The next forceps that we are seeing is also called as corneoscleral forceps, and this is one variety of corneoscleral forceps called as colibri forceps. And you can see that in this forceps we can use for tying the suture by holding the incised segment. Now we will be talking about hooks and retractor. So the first instrument in this is lens expressor. It is also called as lens hook because of the secondary use of this instrument as a muscle hook. It is also called as lens hook, but the primary use of this instrument is to express out the nucleus in extracapsular cataract extraction surgery. Hence it is called as lens expressor. So use the term lens expressor more often than using lens hook. So as we can see this from this diagram, the lens expressor looks like this instrument, and we can see there is a perpendicular tip. So it has a flat metal handle with round curved at one end, and the curved end tip is perpendicular to the flat handle. So this is a curved end tip, and it is roughly perpendicular to the flat metal handle. It is used to express the nucleus during extracapsular cataract surgery. It can be used as a muscle hook if muscle hook is not available. So it is one of the secondary use of this lens expressor. It is used along with wire pectis to extract out dislocated lens. So these are the uses of lens expressor. So this is a lens expressor. It is also called as lens hook. It has a flat metal handle with a round curved end at one end, and this end is perpendicular to the flat metal handle. It is used to express the nucleus during extracapsular cataract extraction surgery. When the muscle hook is not available, it can be used secondarily as a lens hook as well, muscle hook as well. So the name itself is lens expressor, but the secondary, because of its secondary use, it is also called as lens hook. The next retractor is Desmarais lid retractor. We can see this instrument is Desmarais lid retractor. There are various sizes available, and this is and while doing surgery, we should make sure that this end, this curved end of the Desmarais lid retractor, this end should be kept outside, and we usually invert the cilia over this margin, right? So let me make a diagram. So if this is your eyeball, we keep the Desmarais lid retractor in this manner, right? And this is just for showing that, right? Let me make a better diagram than this. So we'll keep this Desmarais lid retractor like this, and we'll invert the cilia in this way. Okay, so this is how Desmarais lid retractor is being used. So it has many sizes available, large and small size are being available. The use of this Desmarais lid retractor is that it is used for double eversion of the eyelid. Don't ever say a single eversion, don't ever say just eversion of eyelid. You should use the term double eversion of eyelid, so that we can examine the superior fornix of the conjunctiva. And why do we need to do that? It is used to examine the eyeball in case of blepharospasm in child, as we are everting the eyelid. So in children with blepharospasm, it is very difficult to evert the eyelid, so we use the help of Desmarais lid retractor. It is also used for removal of corneal foreign body, and it can also be used for removal of corneoscleral sutures. So this is about Desmarais lid retractor. So remember that it is used for double eversion of eyelid, and by everting the eyelid, we can also look for the superior fornix in the conjunctiva, and we can also remove the foreign body from the fornix. We can also use to examine the eyeball in child with blepharospasm using this instrument, and we can also help us to remove the corneoscleral suture as well. So what are the advantages of this Desmarais lid retractor? Since this retractor allows continuous adjustment of the lid, so that the width of the palpebral aperture can be changed as we want. Right? So as we can change we can enlarge the palpebral aperture as much as we want using this instrument. So this is a very important advantage of this Desmarais lid retractor. But there is a disadvantage that it is not self-retaining. So you need an assistant to hold it. So at least two people are required for this procedure. Right? So the disadvantage is that it is not self-retaining, and assistant is needed to hold it. So this is our Desmarais lid retractor. As we can see this, it has a curved scooped out part, and it is available in different sizes. As we can see that it is used to evert out the eyelid for double eversion, so that we can expose the fornix. So how do we use it? You should make sure that this side is always facing your eye side, and when the person is sleeping, it is placed here and the conjunctiva is everted over this. So this is how we use the Desmarais lid retractor, and it is used to see the fornix. The next instrument is needle holder, and the very important needle holder that we use in ophthalmology department is spring action needle holder. It is also called as Barraquer type needle holder. So it is also called as Barraquer type needle holder. It is also and the name is spring action needle holder. We can see there is a spring mechanism, and you can get confused with this needle holder with different type of scissors that are used in ophthalmology. So I'll make you understand how they are different. Right? So this is spring action needle holder. You can see the tip. Right? It doesn't look like a scissor. I will show you scissor, then you will be able to appreciate it even further more. So Barraquer type needle holder, it is available in various sizes and it might have a straight or it might have a curved tip. As we can see in this diagram, it is having a curved tip in this diagram, but it may also have a straight configuration, and it is available in different sizes. It may or may not have a locking system, it usually has a spring mechanism. The jaws of the needle holder are finely serrated. Right? We can see that if you zoom into this diagram, we can see the jaw of the needle holder they are being finely serrated so that it can hold the needle tightly. So the use is that it is used for passing the suture in conjunctiva, cornea, sclera, in extraocular muscles. So it is used to pass suture in cornea, conjunctiva, sclera, and extraocular muscles. So this is the use of Barraquer type needle holder. So it is used to hold the needle so that we can pass the suture in surgeries of conjunctiva, cornea, sclera, and extraocular muscle. So this is our Barraquer type needle holder. As you can see, it has a spring action and it is like a scissor-like mechanism. We can differentiate it from the scissor by looking at the tip. So it is not having any sharp margin. The tip can be in the form of a straight limb or it can be curved like this. So it is used to hold the needle so that we can suture it. Thank you. The next instrument that we are going to talk about is scissors. There are different scissors which are being used in ophthalmology department, But the common scissors are corneal scissor, the next one is Westcott scissor, and the next one is Vanna scissor. So we'll learn about the uses, and we'll also learn how to differentiate them. So let us begin with corneal scissor. It is also called as section enlarging scissor. As you can see in this diagram, this is a corneal scissor. And from this diagram, we can appreciate the gap which is present in between the two limbs of the corneal scissor. It has a large gap. And because of this large gap, we can use this to enlarge the sections in the eye during surgery. So it is also called as section enlarging scissor. It is of two types. One is universal corneal section enlarging scissor, which can be used for both eye, or there can be right and left curved corneal scissor, which can be used on either sides. It is meant to be used depending on the site where it can be used. The uses are: it can be used to enlarge cornea or corneoscleral incision for conventional intracapsular cataract extraction as well as extracapsular cataract extraction. So as we know, during cataract surgery, especially ICCE and ECCE, we usually create a tunnel, or we usually create an incision at the limbal area. And the incision is usually enlarged by using a scissor, and that is known as corneoscleral scissor. It is called as corneal scissor, and it is also called as section enlarging scissor. So one of the use is that it is used to enlarge cornea or corneoscleral incision for conventional as well as conventional intracapsular cataract extraction surgery and extracapsular cataract extraction surgery. It is also used to enlarge the corneal incision during keratoplasty procedure. It is used for cutting and undermining the conjunctiva during various operations, and it is used to cut the sclera and the trabecular tissue during trabeculectomy. So, being a scissor, it is used to cut different structure. It is used to cut the cornea by enlarging the corneal incision during keratoplastic operation. It is used to enlarge the cornea or corneoscleral incision during conventional as intracapsular cataract extraction surgery and ECCE. It is used to cut and undermine the conjunctiva during various operations, and it is used to cut the trabecular tissue during trabeculectomy. So, this is the use of corneal scissor. The next scissor is Westcott scissor. It is also known as spring scissor. How do we differentiate between corneal scissor as well as the Westcott scissor is that you can see now the gap between the two limbs is less. Whereas in corneal scissor, there was a huge gap present between the two limbs of the scissor. Right? And thus it is not used to enlarge the section. So spring scissor, so these are the stout scissor. It may have a curved end or it may have a straight end. As we can see, it has a curved end here. So Westcott scissor are stout scissor. It may have a straight or curved end, and the blades may be blunt or blades may have sharp tips. So Westcott scissor, also called as spring scissor, they are stout scissor having straight or curved blades with blunt or sharp tips. The uses are: it is used as an alternative to plain straight or plain curved ring scissor. So it is not used as such. It is used as an alternative to other scissor like plain straight scissor and plain curved scissor for cutting and undermining the conjunctiva during various operations, and also used to cut the sutures. So if you are asked about Westcott scissor, you should be able to identify those scissors. It is the size of Westcott scissor and corneal scissor are roughly similar, but you can see the gap present between the two limbs of the scissor. And in that you will find that the Westcott scissor has very small gap. It is not used as such but it is used as an alternative to other scissors like plain straight scissor and plain curved ring scissors for cutting and undermining the conjunctiva, and it is also used to cut different scissors. The next scissor is Vanna scissor. Vanna scissor is a very small scissor. It is a very fine scissor, and it is used for finer operation in the eye. So it is a very fine and delicate scissor, and it has with small cutting blades, which is kept apart by spring action. And it is used for cutting as I've said, Vanna scissor is a very fine scissor. So it is used to do very fine surgeries in the eye. Like it is used to cut the anterior capsule of lens during extracapsular cataract extraction. It is used to cut the inner scleral flap during trabeculectomy. It is used to cut 10-0 nylon scissor. If you have gone in the OT, you will know that 10-0 nylon scissors are very fine sutures. It's very difficult to identify them also. So to cut such fine scissor, you need a fine scissor, and that is your Vanna scissor. And it is also used during pupillary sphincterotomy. It is also used during iridectomy, and it is also used to cut pupillary membrane. So these are the pupil related surgeries like pupillary sphincterotomy, iridectomy, and cutting pupillary membrane. So these are very fine operation in the eye where Vanna scissor can be used. It can also be used to cut 10-0 nylon suture, and it is also used to cut an anterior capsule of the lens during ECCE, and it is also used for cutting inner scleral flap during trabeculectomy. So this is about Vanna scissor, and you can identify that there is an obtuse angle present at the end, and it's a very fine scissor. You can easily identify this. So we have basically talked about three different scissors. The first we started with corneal scissor, also known as section enlarging scissor. Always look at the limbs and the gap present between those limbs. Second one is the spring scissor, also called as Westcott scissor. You can see the gap between those scissors are very less. The third one is the Vannas scissor. In Vannas scissor, you can see that it is a very fine scissor and the end is usually present as an obtuse angle, and it is used for very fine surgeries, and you should be able to understand the surgeries that it can be used to perform. So these are different scissors that we use in ophthalmology department. So we can see there are three specific type of scissor. One of them is corneal scissor. This is our Westcott scissor, and this is our Vannas scissor. So let us begin with corneal scissor. You can see that this corneal scissor, the gap present between the two limbs is very much. So it is used, and because of this there is a large pliability, and we can increase the sections within the cornea, within the scleral incision. So it is also known as section enlarging scissor. So you see the movement, it has a large variety of movement. Whereas in case of Westcott scissor, so this is our Westcott scissor, comparing the size, it is roughly similar to the corneal scissor. So how do we differentiate them? Is by the gap present in between the two limbs. We can see that the gap in between the two limbs is very less as compared to the corneal scissor, and it is used as an alternative to other type of scissor during ophthalmology surgeries, as I have mentioned in the video. And this is our Vannas scissor. You can see the Vannas scissor, it is a very fine scissor, and it is terminating as in an obtuse angle, and it is used for very fine surgeries within the eye, like iridectomy. It is also used for anterior capsulorhexis and other types of surgery, as I have mentioned in the video. The next instrument is clamp, and now we are talking about different clamps. So we'll start with lid clamp. Lid clamp is also known as entropion clamp. So as we can see, it is not a universal clamp because it is used for alternate eyes. I will talk about it by showing you a video. So we can see this is the diagram of a lid clamp, where you can see that there is a handle, and this handle is kept on the temporal side, and it also has a clamp-like mechanism, and it has a plate as well as a rim. So it has a D-shaped plate and a U-shaped rim, as we can see in this diagram. The D-shaped plate is kept inside on the conjunctival side, whereas the outside U-shaped rim is kept on the outside on the skin side. And the next thing I would like to say is that, as you can see at the end, this end are very sharp end, and because of this sharp end, if you are not using it correctly on the eye where it is meant to be used, then it can also cause injuries. So it is not a universal clamp, right? So it is not a universal clamp. It should be used for the eyes where the surgery is meant to be for. So it is present in pair. One lid clamp, for example, if it is used for right upper lid, then it can be used for left lower lid, or it can be used for left upper lid and right lower lid, and vice versa. So as I said, there is a D-shaped plate and a U-shaped rim. The D-shaped plate is kept on the inner margin at the conjunctival side, and the U-shaped rim is kept on the outside margin at the skin side. And it has a clamp-like mechanism which can be used. This screw-like mechanism can be used for clamping, and via the mechanism of clamping, it can be used to achieve hemostasis as well. So how do we use this? The handle should be held temporally. As I said, the handle should be from the temporal side, and it has a D-shaped plate which should be touching the palpebral conjunctiva. It should be from the within. It should be from within or from inside. What are the uses of lid clamp? It is used for eyelid surgeries like entropion surgery, ectropion correction as well. It is used to protect the eyeball and support the lid tissue. And it also achieves hemostasis during surgery. As I've showed, it has a clamp-like mechanism which is used to achieve hemostasis during ocular surgery. But the main use is that it is used for lid surgeries like entropion surgery as well as ectropion surgery. The advantage of this lid clamp is that it is a self-retaining clamp and you don't need an assistant to hold it. But the disadvantage is that since it's a big instrument, it has a very less operative field to operate on, and there is a risk of pressure necrosis if it is fitted very tightly. So as I've said, there's a clamp-like mechanism which blocks the blood vessels, which obscures the blood vessels, so there is a risk of pressure necrosis. So this is a lid clamp. It is also known as entropion clamp, as you can see in this in this video. So this is a metallic device. It has a clamp-like mechanism which is used to achieve hemostasis during surgery, and we can see it is terminating into two limbs. So one of them is a U-shaped rim and another is a D-shaped plate. So how do we use it? It is not universal because it has its different use in different eyes. So roughly we can see that this margin is very sharp. So because of that reason, it is not used in both eyes. So how do we use it? So you should make sure that this side, the U-shaped rim side, should be facing towards the skin, and this plate should be facing towards the conjunctiva. So let me show this in my eye, and the handle should be held temporarily. So you can see that this is a D-shaped plate and the U-shaped rim, and it should be used like this way, As you can see, this will be exposed on my skin side, and another way we can be using is like this way. So where the D-shaped plate will be under the conjunctiva and this will be at the skin side. And we can see if I am using it alternatively, then it can harm the eye, so it is not used in both the eyes. So for this instrument is for the right lower eyelid and the left upper eyelid. The next instrument is a Collagen clamp. I hope you have seen this clamp on your wards and your OPDs. It is very commonly used in ophthalmologic surgery, especially during incision and curettage of a Collagen. So it has two limbs. As you can see, it has a handle and it has two limbs. One of the limb will terminate in the form of a plate and the other limb will terminate in the form of a ring. It has a flat round disc on one side and it has a small circular ring on other side. As I said in lid clamp, as I said that there is a D-shaped plate and a U-shaped ring. So the D-shaped plate is kept on the conjunctival side, whereas the U-shaped rim was kept on the skin side. And it is mostly opposite to that in Collagen clamp. It means that the plate is kept on the skin side and the rim is present on the conjunctival side. But it is not always the case, because it depends on the side where the Collagen is most prominent. Okay? So as I've said, the flat round disc is kept where there is no Collagen, whereas the small circular ring is kept at the site where the Collagen is present. So note that Collagen could be present on conjunctival side or skin side. It can be present in both the side. So we always prefer to put the ring always towards the Collagen side. So it is not fact that always we'll keep the ring on the conjunctival side and we'll keep the plate on the skin side. It is not always the case. It depends on, it varies from case to case. So if the Collagen is predominantly present on the conjunctival side, so we'll keep the ring on the conjunctival side. If it is present on the skin side, then it can be kept on the skin side as well. So what are the uses of Collagen clamp? It is used to fix the Collagen and it is used to achieve the hemostasis during the procedure of incision and curettage operation. So it's used. This is a Collagen clamp. As we can see, this is also a metallic device. It has a clamping mechanism which is used to achieve hemostasis, and it will retain its shape while doing surgery. And it has two limbs. So one of the limb, as you can see, it is terminating into a ring, and the other ring is terminating into a disc. So the mechanism is exactly opposite to that of lid clamp, where usually the ring is placed at the site of the conjunctiva and the plate is placed at the site of the skin. But this is not always the case, as I mentioned in the video. Sometimes when the Collagen is predominant towards the skin side, this may be placed at the skin side and this may be placed at the conjunctival side. So how do we use it? It is universal during that surgery. The additional instrument that we use during lid surgery is Collagen scoop. It is used during incision and curettage to scoop out the content of Collagen during the surgery of incision and curettage. So as we can see, it has a small cup. So it has a small cup with sharp margin. So see, the margin of the cup is very sharp. Right? And so as we can appreciate that, and it is attached to a narrow handle. So there is a narrow handle with which is eventually terminating into a cup, and this is a very small cup, and we can see the margin of the cup is very sharp. So this is Collagen scoop, and the use is that it is used to scoop out the content of Collagen during incision and curettage. The next instrument that we are going to talk is about punctum dilator. So punctum dilator, the full name of this instrument is needle-shaped punctum dilator. It is a cylindrical instrument. We can see that there is a cylindrical instrument, and it has a corrugated metal handle. See the corrugation present on the metal handle, and it has a conical pointed tip. So we can see the tip is conical and it is pointed. Right? If you see the tip very closely, we can appreciate that the tip is not exactly pointed. There is slight degree of curvature which is present at the tip, and it is made in such that because your canalicular path is also in that way. We know the canalicular path has 2 mm vertical direction as well as 8 mm horizontal direction, so it is used in the same mechanism. So needle-shaped punctum dilator is a cylindrical corrugated instrument which has a corrugated metal handle with a conical pointed tip, and it is used to dilate the punctum and the canaliculus during surgeries like DCT and DCR surgeries, that dacrocystectomy and dacrocystorhinostomy, and it is used during your investigative procedure like syringing as well as probing. So, and it is also used during your investigation like dacrocystography. So dacrocystography, during this investigation, what we do is that we usually keep a dye through the canaliculus and it will visualize the lacrimal drainage system. So it is an imaging test for lacrimal apparatus. The next surgery is DCT. Dacrocystectomy is excision of the lacrimal sac tumor. DCR is dacrocystorhinostomy. It is used for excision of the lacrimal sac along with lacrimal bone and the nasal mucosa, hence called as dacrocystorhinostomy. So this is our punctum dilator. It is also called as natal shape punctum dilator. So it is a rod-like instrument. We can see the corrugated handle present in the rod, and we can see the tip is present in the form of a S-shaped bend so that it can fit into the lacrimal drainage system, especially the cannula. The lacrimal cannula initial 2 mm is vertically oriented and the later 8 mm is horizontally oriented. So it is meshed in such way. It is used to dilate the cannula so that we can do various operative procedure like DCR, DCT procedure, and it can also be used for investigative procedure like lacrimal syringing and also dacrocystic cystography. Okay. The next instrument is Bowman's probe, also known as Bowman's lacrimal probe. So it is a set of straight metal wire of varying thickness. Roughly it varies from 0 to 8 with blunt rounded ends. So we can see it has blunt rounded end. We can see there is a blunt round end, then there is a straight wire, then there is a flattened platform, then again there is a straight wire, and then it ends with a blunt rounded end. It is used for it is used to probe the nasolacrimal duct to check for any congenital blockade. It also identifies lacrimal sac during dacrocystectomy and dacrocystorhinostomy procedure. Note that if on probing, if you feel any soft tissue obstruction, soft tissue obstructing the probing tract, then probably it is due to obstruction. But if you are probing and if there is hard matter which is obstructing you from probing into that, then it is probably a bone. It is not an obstructing. So this is how you differentiate any obstruction from that is present in the lacrimal drainage system. The next instrument is lacrimal cannula. So this is a lacrimal cannula, and the similar instrument is an AC cannula. See, AC cannula is made from a metal, whereas lacrimal cannula is made of plastic. Right? This is how you differentiate, because lacrimal cannula is made basically from syringe by bending the tip. Right? So it has a plastic body, whereas AC cannula has a steel body. So what are the uses of lacrimal cannula? So lacrimal cannula is a long curved hypodermic needle with a blunt tip. The uses are that it is used for syringing the lacrimal passage. It is used for syringing the lacrimal passage, and it can also be used as an alternative to AC cannula for putting the air. It can also be used to put tryphan blue dye, pilocarpine, and balanced salt solution in anterior chamber during intraocular surgery. So during intraocular surgery, we might need to increase the chamber of the anterior chamber depth. For which we can use AC cannula. So it is used to put air in the anterior chamber. So during it can also use to stain the anterior capsule by using tryphan blue dye, so that it can be done during procedure like anterior capsulotomy during extracapsular cataract extraction. It can also be used to put drugs within the anterior chamber, that is also known as intrachimeral drugs. And it is also used to push balanced salt solution during hydrodissection surgery. Right? It's a part of cataract surgery that we'll be discussing in video of cataract. So this is our AC cannula. So as you can see, this portion is our AC cannula, and it should be differentiated from the lacrimal cannula in a sense that lacrimal cannula is made of plastic, but this AC cannula is made of a steel metal, and we can see it has an opening at this point. So by this opening and by this instrument, we can keep various instruments in the anterior chamber, like we can keep intrachimeral drugs. We can also use to do hydrodissection with this instrument, and there are many more uses as I have mentioned in the video. So you can see this is an AC cannula. So the next instrument is ocular viscoelastic device. So it is a vial which contains pre-filled syringe, and it is used in intraocular surgery to increase the anterior chamber depth, and it prevents injury within the eyeball. So these are all the instruments that we need to know in ophthalmology. So before ending this, I will also record video on how the instrument would look and how would we use that, especially on the Collagenscope clamp as well as the lid clamp. It should be differentiated, and the way of holding those instruments. Thank you very much. So this is our ocular viscoelastic devices. As you can see that there is a presence of a viscous like material present in this device, and it is used to keep this viscoelastic material within the anterior chamber so that we can increase the anterior chamber during ocular surgeries, and it also protects the endothelium from abrasion while performing intraocular surgeries. So this is your ocular viscoelastic devices. Look at it.